Good afternoon, everyone, and thank you for joining us on the news briefing this Wednesday, July 29th. The County of Monterey's Environmental Health Bureau has played an important role in coordinating information and agencies as part of the environmental review for the Moss Landing Vista Power Plant fire event that occurred. Final documents related to that review are now completed and available for public review. We're going to talk more about that. Very pleased to have Rick Encarnacion and Marnie Flagg from our Environmental Health Bureau to talk about that. Thanks for joining us on the briefing today.
Hi, thanks, Maya. Yes, my name is Rick Encarnacion, Director of Environmental Health, Bureau Chief for the County of Monterey's Environmental Health Bureau. And as Maya mentioned, I'm here also with Marnie Flagg, the Assistant Bureau Chief for the Environmental Health Bureau. Today, we are releasing the preliminary environmental assessment report related to the Moss Landing Vista thermal runaway incident. This report represents the county's coordinated effort to ensure that environmental testing conducted in our community, along with the independent technical evaluations and regulatory reviews by our state agency partners, are available to the public in a transparent and accessible manner. The County of Monterey's Environmental Health Bureau served as the coordinator for this process. Our responsibility was to facilitate off-site sampling in the community, bring together the appropriate state agencies, and ensure that information is shared openly with the public. As we move forward, any decisions regarding environmental cleanup, long-term monitoring, or regulatory actions will be made in coordination with state agencies that have the legal authority and scientific expertise to oversee those responsibilities. Now, our commitment remains clear: to provide the public with timely, transparent information, to support our state partners, and to ensure our community has access to the best available science as decisions continue to be made. So with that, if there's any questions, Marnie and I are here to answer. I think you're on mute, Maya.
Thank you. There are a lot of buttons here today for some reason. Thank you so much for giving us an update on this. The community very interested in these reports and learning what's next. There was a little bit of a discussion about what the time frame might be in the wake of these reports. Is there going to be additional work done? What could the public be looking forward to after they are looking at these reports?
I'll chime in with that, Maya. Thanks. So, I think it's important to note, I just want to make a few general references back to what Rick said, that our goals are definitely transparency, protecting public health, and ensuring that all of our conclusions are bound in some science. So we had the agencies, California Department of Toxic Substances, DTSC, the Office of Environmental Health Hazard Assessment, or OEHA, and the Central Coast Water Board. All of these reviewers acknowledged that this report is improved on any preliminary data that they received. Each agency identified additional questions, and they requested further clarification as well during this whole review process. It's important to understand that none of these agencies rejected the report, and none of the agencies fully endorsed every conclusion in the report as well. Some of the remaining questions, there are remaining questions, and those will be looked at in further discussion with the state partners. But we want to, take a look at it, if additional ecological evaluation is appropriate, how any further investigation or reports should characterize uncertainties that were created because the sampling timing. And then we want to take a look at whether additional biological information should be collected as well in the nearby areas. But it's just important to, in answer to your question, it's important to reiterate that the scope was only evaluating off-site soils that were sampled, sediments, and some surface water samples that we pulled. It's not making any conclusions about groundwater, on-site contamination, or any broader watershed investigations.
Marnie and Rick, I know you just put a link in the chat. Can you tell people where they can find the report, which is now, these reports are going to be online and available for review?
Correct. They'll be released at 1 o'clock today, and they'll be on the Ready Monterey County website.
And so getting back to your points about who else was involved and what they did or did not do in terms of what these reports said, it sounds like there is still work to be done. And for people who may have been concerned about what happened, I think there's encouragement in that really the look at this is not over.
Right. We expect some additional work, further evaluation of sediment findings, ecological analysis, some clarifications of things that were reported, and continuous groundwater investigations too. The Central Coast Water Board, it has an order out that's assessing the groundwater and any aerial deposits, watershed transport. So they're definitely on the case, and their findings are still to come. But they have their own regulatory research and policy processes. And this report will help inform them and the further things that they're going to do.
And speaking of further, I'm wondering if you could put things into context and let people know kind of who does what, because there were a lot of agencies that had a lot of work involved in this. What was the environmental health role, and then what was the state agency role?
So our role is to coordinate and facilitate all of the agencies. And, you know, we're not the subject matter experts in this, so we went and found them and pulled us all together to take a look at each of our specialties. The county's role, environmental health, you know, it's really to ensure that public health remains a priority. It's going to stay the priority. And we're going to make sure that the regulatory agencies have the information that they need. And we also want to make sure that the public has accurate and transparent information that we have. We want to provide to them this whole time. So, you know, it's key too that we rely on the public to tell us things that are happening too, and to give us feedback. So, you know, if they there's an email address associated with the press release, ehinfo@countyofmonterey.gov. And emailing that will help us kind of keep on track with what the public needs and how we can direct our agencies to produce that.
And so I've got an incoming question. I'm going to take it in two parts. And one is for me and one is for you, Rick and Marnie. The first one is, why are county officials talking at a public meeting about a report that has not been released to the public? The reason why we're doing it right now is because our news briefing is scheduled at noon. And that is when people were available. The report is being released at 1 o'clock, just simply in advance of this conversation. This news briefing will go online and people can reference it after the reports have been released, but it was just all about timing. The second part of the question was, what are the conclusions of the report? And I think you spoke briefly about what some of the findings were. Can you talk any more about any additional conclusions?
I think, you know, the report evaluated the soil, sediment, and surface water following the fire. Based on those samples that were collected, the consultant that wrote the report concluded that the samples did not pose an unacceptable risk to human health or the environment. So I think it's important to understand that this is coming from the perspective of Vistra's consultant, and the conclusions that they made are from that, with the guidance of our state partners.
And for the public that's going to navigate reading these reports, I'm wondering if you might give them a few guidance tips, because these are big reports. There's a lot of information there. Is there any, guidance on what the public can be looking for as they try to look through all this information?
It is a big report, Maya, and it is difficult to sift through. So I recommend just taking it section by section. The conclusion section, that's important to read first to get the gist of what the consultant is saying about the project as a whole. If you're not a data-oriented person, it's going to be difficult to sift through all of the sample data and everything else that's in the report. And, if you have questions about that, if you email us, we can forward it to the consultant and try to get you an answer on that. But those will be hard. But I would definitely stick to the introduction, the conclusion, and then seek help with the other sections that you may have questions on.
And then another question here, will the report be presented to the Board of Supervisors with some analysis?
So the board will receive the report as well. It is being released today. And they will have the opportunity to read the report as well as our agency partner comments. Environmental health won't be producing an interpretation of the report. So they will need to utilize the OEHA and DTSC comments to pull from there the information that they need.
I'm also wondering if you could say again the email for the public that has questions about this, because as you said, this is a big report. There's a lot of information there, and there's a lot of community interest in what it has to say. So if you could give us that email again right now.
Sure. ehinfo@countyofmonterey.gov.
And then prior to this report, I know that people have questions. Can you kind of give a snapshot of one of the most common questions that people have had to date?
I think one of the most common things that we're seeing are health effects, and is my issue being caused by the fire or the smoke plume? And that is something that this report was trying to get a grasp on if there were, environmental effects from the incident. Basically, the report notes that there's no concluding evidence that there is an environmental effect for long-term exposures. So I think that folks that are still experiencing things should definitely still go to their physician and still report the things that they're seeing, because that's going to help us facilitate the future direction that we go in.
And here's a perfect timing. I have one more question for you. See if I can catch it all. I'm hearing some hesitance from the speakers to stand behind this report's conclusions. Does environmental health have reservations about the findings or concerns about how the public or board might respond to it?
No, I think any hesitation is that I'm looking to make sure I express the right words. It's a big report and I want to make sure I get it right. But that being said, environmental health facilitated. We brought the state partners and Vistra and their consultant together to produce the report. And we had our experts, OEHA and DTSC, make the comments and the water board on there. So since they're our subject matter experts and they're not saying that the report is false or that they totally disagree with it, will err on the side of our state partners.
And
Yeah,
then
I'd like to add to that, if I may. There is no
Rick.
hesitance on, Environmental Health Bureau standing by this report. It was very highly coordinated, a lot of experts in the room at the state agency levels, and holding Vistra accountable to participating in this report, having professionals involved. So we do stand by this report. We'd also like the public to know, like what Marnie's been mentioning, we're your local health inspectors. We're here to facilitate information and provide transparency, as well as try to coordinate the expertise and bring that into the county so that actions are done appropriately.
This next question might help you expand upon that a little bit. Is Monterey County Environmental Health writing its own independent report or relying on Vistra's consultant? How can the public be assured that they are getting an independent assessment and not something biased from the company that is responsible for the fire?
I can let Marnie chime in on this, but I just want to say, again, the process in producing this report was done in conjunction and cooperation and guidance from our state partners, the professionals, DTSC, OEHA, CDPH. These are the professionals you want in the room, especially for the local levels, to assist the locals in providing this information. And then Marnie can chime in.
Exactly. That's, when our state partners are able to comment and take those comments back to the consultant, and then they review them and, update and take those things into consideration, that's definitely a collaborative effort. And that's what happened. So with them having their opinions heard, their letters are going to be posted as well for transparency, so everyone can read the points they made and the facts that they went by. I think that definitely shows that it was a partnership and they were involved in that.
And another question, it was mentioned that state partners did not endorse all the report's conclusions. Are those noted in the report?
So you can find all of that in the subsequent attachments that will be available on the website, the statements from our state partners and the final suggestions that they had in court in reference to this final report that was released.
So then is this a preliminary, and this is another question, is this a preliminary report and will there be a final report coming in addition?
This is the final report. This is the final PEA report.
Any last things that you would like to say, Marnie or Rick, and then any other additional questions from our partners online? Give people that opportunity.
I just want to say, this report is a milestone in the process. It's not the end, it's just a milestone. I think our partners, the agencies, they've acknowledged that there should be improvements. And they've also identified good points in the report as well. And I think, these questions will come from the report and, we'll have to address those in the coming future as well.
And then one additional question, is anyone else doing any other reports looking at environmental or health impacts of the fire, or is this the only one? This could be the only one with the state involved, but who else is out there working?
I believe there are other people working. There's a local group that's working. And, we're happy to work with them and give them all of our information as well, should they need it for their report. But since this is the first one to come out, I think it will influence any other ones that follow along.
Any other additional questions before we move on to the next topic? Any other additional things from you, Rick or Marnie? Nope. Thank you. Thank you so much for being on in advance, trying to fit your time in advance of the release and get this information out. Really appreciate you both being here today.
Thank you, Maya, and I've loved doing the briefings with you. On
to our next topic, the annual point-in-time count provides a snapshot of those experiencing homelessness in our community. The 2026 count was done at the end of January. The data is in, and it's showing some good news as far as efforts to reduce homelessness. We're going to talk about the numbers, but why also we can't be complacent with this good news. We have Roxanne Wilson, our Homeless Services Director, to tell us more. Hi, Roxanne.
Hello. It is with great honor and pleasure that we announced that the Coalition of Homeless Services Providers had released the point-in-time count for 2026. And with that, we have seen fairly significant reductions across the board. For overall homelessness, we have seen a 15% reduction. And for unsheltered homelessness, we are actually looking at a 23% reduction. I'm going to share this screen just for those on the call. Oh, wrong button. Sorry. I keep pressing all the wrong buttons. Share. I think this will be helpful. There we go. Okay. So as you see again, this is the third point in time count in the last 4 that Monterey County has experienced reductions. So we're very proud of the work that is happening in this community. It does demonstrate that all of the different sectors are starting to close the gaps, and that we are doing exactly what the funding is asking us to do. We're looking at unsheltered homelessness, we're decreasing overall homelessness, and increasing the number of individuals that we're pulling into services. Another important screen that I want to share with you is here, because as noted, we're seeing reductions across the board. The screen that you're looking at right now, this is for the subpopulations. Veteran homelessness had a decrease of, let me do the math, 43%. Chronic homelessness is down 39%. Family homelessness is down 30%, and there's a 37% decrease in unaccompanied children and transition-aged youth. This is probably something that people are very interested in. It is by jurisdiction. You will note that in the city of Soledad, Greenfield, Delray Oaks, Carmel, anywhere where there is a star, the consultants that put together the report did not include a percentage decrease, because that means that the numbers are below 25. The most substantial area to draw your attention to is that unincorporated homelessness has went down 72%. And I think that this is tied to the 3 encampment resolution funding programs that the county has rolled out. One to address the encampment right outside of the city of King. Another one is to address the encampment near Soledad. And the third one is to address the encampment in the Pajaro River. The Pajaro River does still have people living on there, but one of the things that the Continuum of Care had done this year, which has been different than other years, is that they worked with the County of Santa Cruz to ensure that the point in time count was done on the same day. And that reduced duplication of counts on the Pajaro levy. There was also an increase in King City, but that is a little, it's about timing more than anything. As many of you guys are aware, the city of King worked with the County of Monterey and the Housing Authority to open up their Project Home Key, which is known as Casa de Esperanza. What originally happened is we moved all of the individuals that we identified who are experiencing homelessness on the King City River and around King City inside of a hotel while we waited for Casa de Esperanza to open. Casa de Esperanza opened after the point in time count was conducted. So next year, not next year, in 2028, when the point in time count is conducted again, we do anticipate that there will be a significant decrease as all of the individuals who qualified moved into Casa de Esperanza and are now permanently housed. When individuals are inside of shelter, they are still considered homeless. So they are still counted under the sheltered count. Let's see, is there anything else that's really important for us to note? I think I'm going to go through this really quick. We will be doing a full presentation to the Board of Supervisors on August 25th. So I do plan on releasing this entire report or the presentation, but the report will be released within the hour. This is also something that is interesting that we've noted. In 2024, the number of individuals who are experiencing their first episode of homelessness in Monterey County was 23%. What we were seeing back then is most people were homeless multiple times, and they were homeless for extended periods of time. What we're seeing now is that the first episode of homelessness actually increased to 60%. And what this means to us is that although we're doing a great job at serving individuals who are currently unsheltered, we really do need to increase resources to address the pipeline into homelessness. Housing is becoming incredibly unreachable in this community and other coastal communities of California. I think the latest data that I had read is that you have to make over $80,000 a year in order for you to afford an apartment here in Monterey County. And just think about all of the people in our community who do not make that amount of money. So until we address that issue of the lack of affordable housing and the lack of resources to keep people from falling into homelessness, it is quite possible that these numbers will change, and we will continue to see individuals coming into the system. There's another interesting fact that I think most people are concerned about is, are we serving people who are from Monterey County in our community? Historically, there's been narrative that we're serving people from San Francisco and San Jose, and historically, the data has told us that's not true. This year, for the first time ever, we're seeing that nearly 90% of the people that we're serving inside of our community are actually Monterey County residents, or they were in Monterey County when they became homeless. It is a very small number of individuals who came from other communities. I think at this point, this is the total. Actually, this is a good one as well. You'll see that what we ask is how many people have some experience with the justice system that is a part of this survey. And historically, it has been about a little bit shyer than a third of the population that has been involved with the justice system. However, this year we've seen a significant decrease. Originally it was 26%, and now it's 19%. And we do attribute that to all of the work that the Behavioral Health Bureau and the Public Defender's Office has been doing with the Prop 47 grants. Also, the state of California released an initiative called CalAIM, and that also has a huge component that addresses those who were incarcerated and ensuring that when they are discharged from jail, that we have some sort of system that keeps them from just going straight into homelessness. So like I said, there's a lot of work that's been done. But going back to what Maya was saying is that while we are showing so much progress in all of these areas, the reality is we're operating on one-time funding almost across the board. And now there's so many changes and priorities for this for the federal government, and the funding sources that we had under the Newsom administration are not guaranteed next year. So we're certainly bracing ourselves for significant changes in our community. It doesn't mean that the work does not continue. Every department within the County of Monterey touches homelessness in some capacity. We certainly have several meetings with Public Works Department and Bridge and Facilities. We also have meetings consistently with the Health Department and the Department of Social Services and all of the bureaus within. I think that the moral of the story is that as things are changing, our system has to keep up with those changes. And I would say that now better than ever, we are starting to lean into each other more, communicate and coordinate. It is a very fragile ecosystem that we're operating in, but again, we're very excited, and we'll celebrate today that all of that good work that's been happening in the past 2 years are actually coming to fruition and showing in this report.
Roxanne, thank you for the overview. And I've got two questions for you to come in, but I'm hoping you might talk about why we're seeing good news, but it's still not over. There's such a moving target with some of these numbers because of challenges that continue where you work in one area where we get funding to, help people, but yet these outside challenges still affect people being homeless. We can't seem to stop it.
Well, it's interesting. The federal administration has changed so much about where their priorities lie. And for the first time in, I believe, 13 or 18 years, that we are no longer prioritizing permanent housing from the federal administration. We are now required to prioritize temporary housing. And as I mentioned earlier, when people stay in shelters and in transitional housing, we still count them as being homeless. There is, and as I also mentioned, with the change in the state administration, we do not know what the new incoming governor's priorities are going to be. So it's almost like we're starting all over again in trying to reorient ourselves to the new priorities of both the federal and state government. One of the things that I think is going to hit us pretty hard in this community is what's called the Continuum of Care Grant. This has been a renewable funding source for the homeless system. It's managed through the Coalition of Homeless Services Providers. Historically, 95% of what's called the annual renewal demand was almost guaranteed to be funded. So if you look at all of the organizations that are funded with COC money, HUD would guarantee at least 95% of the applications that come back to them every single year would be funded. This year, HUD dropped it down to 60%. And they are no longer prioritizing permanent housing. They want us to do more straight outreach. They want us to do more transitional housing and services only. There are national organizations who project that 97,000 people will become homeless because of this one federal shift. That more information on that is available on the National Alliance to End Homelessness website, if anybody is interested and likes to just geek out on homeless data like I do. There's also a new proposed rule for HUD that mixed households will no longer be able to stay inside of federally subsidized housing. That impacts our community actually quite a bit. The mixed household status essentially means, let's just say, for example, mom or dad are not citizens or not residents of the United States of America, but the husband and children are. Essentially, what would happen is that the local housing authorities would just prorate the rent and not count the mom or the dad or whoever is undocumented inside of the subsidy. But there is a new proposed rule from HUD that will end that. And you think about all of the people inside of the state of California in general who have mixed households and how that's going to impact those who are currently stably housed in affordable housing that's subsidized by the federal government. I can keep going about all of the things that are changing, and we're just bracing ourselves for impact. But as I mentioned today, we celebrate. There's a lot of work that's been done, and we're very proud of it, of the work that's been done, and looking forward to all of the continuing on with that work and closing the existing system gaps.
So then let's get to the questions. First question, do you have information on how many shelter beds are available for unhoused individuals in Salinas? Is it just the share center?
No. Currently inside of, I do not have the exact number. That information is counted on the same exact day as the point in time count. It's called the housing inventory count. You can go to the Coalition of Homeless Services Providers to request the exact number because it's not really reflected inside of the report that we have. But it is not just the share center, which does account for over 100 beds of shelter in Monterey County. We do have, in the city of Salinas, excuse me. We also have the domestic violence shelter in Salinas. We have the Victory Mission shelter in Salinas, and we are currently pursuing a grant with the city of Salinas to open up a new shelter for unaccompanied adults. But it is true that the Chinatown Navigation Center did shut down this year after the point in time count, about 2 months after the point in time count.
And the impacts of that was the next question was what the impacts of that on.
It would not be reflected, well, essentially the individuals that was staying inside of those beds would be counted in Salinas sheltered count. So they would still be considered experiencing homelessness, but they would be considered sheltered. I will tell you that I am aware that the city of Salinas worked closely with the Continuum of Care and all of the nonprofits that serve individuals experiencing homelessness, to try to make sure that every person who qualified for existing resources was connected, and that did include some permanent housing outcomes and also some transitional housing outcomes as well. But I
And then,
cannot speak on behalf of the city.
Okay, absolutely. Another question, can you speak to the higher percent of people sleeping on the street? And that was from your one of your slides, either the last or second to the last slide.
Okay, let me just go back to that so I could reference the number. Oh, yes, it did go from 45% to 69%. This is an interesting thing because we do rely heavily on, well, the coalition, excuse me, relies heavily on volunteers, especially people experiencing homelessness, to help do the survey and get the sample data. While it is important to note that there was an increase based off of the information that we're seeing, when you're taking samples of data, there are these anomalies. Like, is that individual only going to people who are sleeping on the streets and not working directly with individuals who are inside of shelters? And sometimes the coalition works very closely with shelters to do that sampling of data, but people have to want to do the survey. So sometimes there's these little nuances that can create weird anomalies inside of the data, I guess is what I'm trying to say. There was, let's see what happened in January. The point in time was done on January 30th. Yeah, I think aside from the fact that we're relying heavily on others to bring us data, it is possible that that was just an anomaly. I'm sorry, I wish I had better information for you on that.
Well, no, that's the question. You can only answer the question that's in front of you. And hopefully for the person who asked the question, did that let me know if that answered your question? And I got that as a yes. Thank you. Any other additional questions for Roxanne before we move on to our next topic? Roxanne, really appreciate you jumping in kind of at the last minute. I know this information was just evolving today, and I really appreciate your time.
Thank you so much. Have a good one.
So now we're going to move on to talk about the South of Salinas Highway project. If you commute on Highway 101 south of Salinas, you have been hearing about this project that is coming up at the beginning of next year. There are actually two projects that are a part of this, and they're going to make some dramatic changes. We're very pleased to have Meg Henry. She is the project manager with Caltrans, and also John Olejnik, also with Caltrans, to talk about this. Thanks so much for being on the briefing today.
Hello, thank you so much for having us. My name is Meg Henry. I'm a Caltrans District 5 project manager, and I manage all of our projects in the South Salinas corridor on Highway 101. And I also want to introduce, before I start my brief presentation, I want to introduce John Olejnik, who's our District 5 Office of External Affairs Chief. And he may chime in at the end of the presentation and answer some questions as we go along. So jumping right in to be sensitive to time, we actually have two projects in the corridor that we'd like to highlight for everyone here today. The first one is what we call our South of Salinas Access Management Project, otherwise known as the Safety Project, which is a short-term project in the corridor. It's coming up fairly soon. And after I talk about that one, I'll switch over and talk about our longer-term corridor improvement project. So the South of Salinas Access Management Project, the Safety Project, is addressing this issue. Most of you have probably driven through this corridor, so you have a visceral sensation of what it's like when folks are making the left turns. We statistically are seeing at least one fatal injury collision per year in the corridor at these 11 at-grade intersections. So the Safety Project will be closing the median to address the left turn issue. Currently, this is the existing condition of the South of Salinas corridor. So when we say the South of Salinas corridor, we are referring to the segment of Highway 101 between Chular and the south end of Salinas, or just south of the airport road. off-ramp. And as you can see, these gray dots identify each of the 11 locations where we currently have at-grade intersections. 7 of them are local roads, 4 are driveways. So what the safety project will do is it will actually put up a new median barrier, which will preclude any further left or U-turns. So again, this is our near-term project, and it's meant to go into effect only until our longer-term corridor improvement project comes through and completely updates this corridor. But once this goes into effect, there will be no more left turns at any of those 11 at-grade intersections. Right in, right out will still be possible. And this is just an example of a median barrier a little bit further north on 101, but it's a good example of what will still be possible. So here's a local road that you can see interacting with the highway. And obviously people driving onto or off of this road are still able to make right-hand turns off, right-hand turns on, but no left across that barrier, obviously. Now we're going to have a metal beam barrier, so our barrier will look a little different than this concrete barrier, but same end result. We'll also be, as part of that project, doing a few improvements in the community of Chular. One is that we'll actually be widening and lengthening the southbound off-ramp into Chular, as well as widening the top of the ramp to better accommodate truck movements. We're also, at the request of Supervisor Lopez and the community itself, adding another stop sign on the westbound leg of the Grant and Main intersection. So when does this happen? Pretty soon. We are actually out to bid right now for a contractor on this project, and we expect to be awarding the contract to a contractor in October. So we're projecting an approximate construction start date somewhere between November and January, depending on the time they need to mobilize and weather and so forth. But our target date is to at least have temporary barriers up, closing all 11 of those intersections, not later than March 1st of 2027. So it could be a little bit sooner than that, depending on how quickly our contractor mobilizes, but the target is to be closed by then. And that's a date that we here at Caltrans we went to the community, especially the agricultural community, and talked with them about the winter travel patterns versus the spring mobilization for farming in the area, and determined that March 1st would be the optimal time to get that in place before the spring activity really ramps up. The other project. So we also had, as I mentioned, the long-term corridor improvement project. So the safety project, in a way, is meant to be sort of a prequel, if you will, or it's sort of a first step toward this longer corridor improvement. So ultimately, what we are aiming to do with the South of Salinas corridor is to relocate both the existing Chular interchange just north of the town of Chular, which is something we've been working with the town of Chular through Supervisor Lopez to determine placement of that new interchange. This, by the way, is not to scale. It's just a graphical representation of what the improvement would look like. And then the project will also relocate the Abbott left-hand off and on ramps with a full service Abbott interchange slightly north of those existing ramps. And once those are done, we will then connect those two ramps with the local county road. So the dashed blue lines between the little green dot with the C and the blue dot with an A is denoting the new county roads. We'll have a western county road and an eastern county road. And we've also been partnering closely with Randy Ishii and others in Monterey County Public Works Department to work out the details of these new county roads that will connect the relocated interchanges. So we have a couple diagrams. These are quite old now, but I wanted to share them anyways. We're still working out the local road connections, but what you're looking at here is an aerial view of the community of Chular. You can see it there on the right-hand side of the image. So north is to the left in this image, south is to the right. And this is just a two-dimensional representation of what a relocated interchange could look like at Chular. The current bridge, the Main Street Bridge in Chular, would remain, but the old off and on ramps, that currently existing off and on ramps at Chular, would be removed and replaced with this new interchange. We are currently studying 2 locations to relocate the full service Abbott interchange. So this graphic represents in the white and the green what those 2 locations are that we're currently studying. The actual details of both locations is the same. It's just one versus the other. So we're currently studying that. So this would be just north of the existing Abbott Street ramp. So we're currently in our environmental review phase. We are anticipating circulating a draft environmental document. It will be an EIR, an environmental impact report, in early 2027. We are anticipating finalizing that environmental document in late 2027, and we are studying a total of 4 alternatives for the project. Where can you get more information? So we actually have 2 websites. Caltrans recently launched what we call our project public portal, and that's that top address that you can see on the screen. You can also hit the QR code that's up on the screen right now, and that will take you to our project portal. It has information about both projects. It also has contact information for me, as well as our public information office. And there's lots of other really interesting information there. You can also go into that portal, and there is a page called Stay Informed, where you can add your email address to our email list and get more information when we send out update emails. What's next? So we are currently in a safety project messaging campaign. So the first project that I talked about, which will be coming online in less than a year, we are currently actively messaging. We're putting out email messages to everybody on our email list. And again, you can put your email onto that list by following the QR code. We're also posting now monthly to social media. So that's Instagram, X, and Facebook. So you can follow District 5, Caltrans District 5, to see those messages come through. And we greatly appreciate any organization that wants to pick up our posts and repost them as well, just to get us more publicity. We do plan to have open house public meetings this fall. The exact dates have not been posted, but we will post those dates probably around September 1st for meetings in October of this year, where we will give updates on both projects, and there will be a whole lot more details. So if you want to find out more, go ahead and follow us, check our website, and those dates will get posted fairly soon. And then following those October meetings, we do anticipate having draft environmental document circulation meeting sometime in early 2027, dates to be determined, but probably before we get to spring. And I'll leave it there for any questions, or unless John wants to add anything on to what I shared.
Thank you, Meg. I was able to put a link into the chat to the website as well for people to copy and find easier. And it's been a privilege over the years working so closely with the community, our partner agencies, the stakeholders, the farming groups, agriculture, landowners, operators. We've had many years and many meetings and times to talk about this project. So we really appreciate it.
Thanks, John.
John, and thank you. And first of all, John, I apologize for what I did to your last name on your introduction. I really appreciate you both being here. And you mentioned the previous communications with the community. You guys have held a lot of community meetings. You've had listening sessions and community, input opportunities. Besides the safety issue, I think that really goes to the value that you see in this corridor and the importance of this particular corridor, not only just because you live there, but because there's so much business and so much, visitor traffic going on there.
That's correct, Maya. And I failed to add in my haste to go quickly that we have an exceptional partner in TAMC. That's the Transportation Agency for Monterey County. And we are partnered very closely with them. They are actually the project sponsor. They're bringing a lot of funding to this project, and we're working with them to get all of the funding we will need. This is quite expensive project. So we do have excellent partnerships with TAMC, and we're working really closely with them. And this is a priority project for TAMC. And of course, also Monterey County Public Works and Monterey County Planning. We've also really engaged with the city of Salinas. So this has been a really, as John mentioned, a really exceptional project for the amount of stakeholder engagement we have had and that we intend to continue to have going forward. So lots of good stuff is coming, and definitely keeping track of that through our website is a great way, and also following us on social media.
And I know that the community meetings gave you a lot of input on what the residents' concerns are, because this is a really big change, and it's not this is not a small undertaking at all. This has, been years in the making.
That's correct. Early on, we had several different locations for the relocation of the Abbott interchange. We had several different possible locations for relocation of the Chular interchange. And we spent a lot of time dialoguing with Supervisor Lopez in the community of Chular, and also with a lot of agricultural businesses, with the Farm Bureau, with just local property owners, with interested stakeholders. We've actually been trying to engage recently with CBDIO, who represents a lot of the Oaxacan speaking farm workers and other communities, to really get out there and understand everybody in this community and hear their voices, and then also let them know what we are doing as we move along.
Thank you. And if you could go over how people can sign up for the email messages again. I know we dropped information in chat, but this is also streaming on YouTube and Facebook. So if you could kind of go over where they could sign up for those email alerts. Let
me just share once again really quick, because I still have the QR code up. There's a QR code, and actually I'm going to back up one slide. There's a QR code. Let's see. Can I back up a slide? There we go. Okay, so there are the top URL on this page. Hopefully you're seeing the two website links here on the page I'm sharing. The top URL is the URL to the Caltrans project portal. And that QR code will also take you there. So you can just grab that hopefully right now. If you go there, there's a series of tabs across the landing page of the portal, and one says stay informed. So if you go to that, there's a very simple page where you literally just put in, I think, your name and your email address, and that will come to us, and we can then add you to the master contact list of interested parties we have for emails, so that when we email out to let folks know about project updates or upcoming meetings, you'll receive an email for that.
Meg and John, thank you so much for being here to talk about this project. This is so important, and it's going to be such a big change. And I think it will help people get ready for the patience that they're going to need, because with road construction comes a new way to be calm in the car, because it's for a greater purpose, right?
Exactly. Thanks, Maya. Well put.
Thank you. All right, finally, last but absolutely not least on the briefing today, for nearly 20 years, your county WIC program has held an awareness event supporting breastfeeding and mothers. It started as a community walk. If anyone was around Salinas 20 years ago, they saw mothers and their babies walking through the neighborhood to raise awareness. And now it has really blossomed into a full-on health fair with community partners. So we're very pleased to have Maria Saavedra and Jazmin Medina with our health department to talk about this breastfeeding awareness fair and walk. They are doing the walk still, aren't they, ladies? And I think you're muted.
Hi there. Hi, Maya. Yes, we are. We are doing the walk. Yes.
So tell us more about the fair. What can people expect this year?
So we're trying to share our screen, so hopefully we do it the correct way. Go here. Okay. And well, good afternoon. My name is Jazmin Medina. I am a certified lactation counselor here for the Monterey County WIC program. And in August, we do celebrate breastfeeding with our annual health fair and our walk.
Hola, and I'll be doing the Spanish version of this. Hola, soy María Chayo Saavedra, especialista de lactancia con el programa de WIC del Condado de Monterrey. En la primera semana de agosto celebramos la lactancia materna con una feria anual de salud y caminata.
So World Breastfeeding Week is the global campaign that promotes benefits of breastfeeding, the importance of education, advocacy, and support. This is led by World Alliance Breastfeeding Action in support with two other organizations, World Health Organization and UNICEF. Despite the benefits, we do know that fewer than half infants that are under 6 months are exclusively breastfed. So this highlights the importance of greater awareness and support to breastfeeding families. Each year, the World Breastfeeding Week focuses on a specific theme, and this year's theme is Breastfeeding, a Sustainable Start in Life, Strengthen What Works.
La Semana Mundial de la Lactancia Materna es una campaña mundial que se celebra cada año del 1 al 7 de agosto para crear conciencia, promover los beneficios de la lactancia materna y fortalecer los sistemas de apoyo para las familias que amamantan. A nivel mundial, es coordinada por la Alianza Mundial para la Acción en Favor de la Lactancia Materna, en colaboración con la Organización Mundial de la Salud y UNICEF. A pesar de sus beneficios, menos de la mitad de los bebés menores de 6 meses reciben lactancia materna exclusiva, lo que pone de manifiesto la necesidad de brindar mayor apoyo y educación sobre esta práctica. Cada año, la Semana Mundial de la Lactancia Materna se centra en un tema específico que aborda distintos aspectos de la lactancia, como el apoyo de la comunidad, las políticas en los lugares de trabajo y los sistemas de atención médica. El logo de este año es Lactancia Materna, un inicio sostenible en cualquier circunstancia. Fortalezcamos las acciones que funcionan.
And let's review what the American Academy of Pediatrics and WHO organization's recommendations are when it comes to breastfeeding. So it's exclusively breastfeeding for approximately 6 months after birth. After 6 months, introduce complementary foods while continuing breastfeeding, and continue breastfeeding into at least 2 years of age or older as mutually desired by mother and child.
Queremos compartir las recomendaciones de la lactancia de la Academia Americana de Pediatría y la Organización Mundial de la Salud, que son las siguientes. La primera es lactancia materna exclusiva durante aproximadamente los primeros 6 meses después del nacimiento, y después de los 6 meses introduzca alimentos complementarios mientras continúa la lactancia materna, y finalmente continuar la lactancia materna hasta por lo menos los 2 años de edad o más, según lo desea la madre y el hijo.
And next, here we can see a comparison of our state versus our county breastfeeding rates. So as we can see, in general, our Monterey County rates are higher than our state average. And luckily, those rates are being slowly increased over time. Our breastfeeding team has been working very diligently to promote breastfeeding and to make it easy and supported choice for our families.
Aquí podemos ver una comparación de las tasas de lactancia materna del programa de WIC del condado de Monterey contra las del estado de California. En general, las tasas de lactancia materna de WIC del condado de Monterey son más altas que el promedio estatal. Afortunadamente, las tasas han aumentado lentamente con el paso del tiempo. Como pueden ver, nuestro equipo de lactancia materna en WIC ha estado trabajando bastante para promover la lactancia materna y hacer que amamantar sea la opción más fácil.
We wanted to share additional breastfeeding resources. Our page 831 Breastfeeds is a collaboration between 3 local agencies, Monterey County, Santa Cruz, and San Benito. We have La Leche League of Monterey County as well, and of course our WIC program.
Para más ayuda con la lactancia, aquí están 3 recursos locales. La página electrónica 831breastfeeds.com, que es una colaboración entre los 3 condados el de Monterrey, Santa Cruz y San Benito. También está la Organización Mundial de la Liga de la Leche del condado de Monterrey, y claro, nuestro programa de WIC del condado de Monterrey.
And finally, we wanted to invite you to our 19th annual Breastfeeding Walk and Health Fair that will be taking place next Tuesday, August 4th from 11 to 2 p.m. The walk does start at noon, and you get a free t-shirt if you walk. It will be here at our WIC office, 632 East Allison Street. So please come by, bring your family, friends. We're going to have a raffle. We're going to have the farmer's market where you could buy your fresh fruits and vegetables, and you can enjoy a free bowl of food from our local food bank. They're going to have their food truck.
Finalmente, los invitamos a la 19ª Feria y Caminata Anual para celebrar la lactancia materna y la salud. Será el próximo martes, 4 de agosto, de las 11 de la mañana hasta las 2 de la tarde. La caminata comienza a mediodía. Se toma a cabo en el WIC de Salinas, ubicado en el 632 Este, calle Alizal. Los invitamos, traigan a su familia y disfruten de la Feria de Salud. Reciban una camiseta gratis, entren en la rifa, habrá juegos para niños, pueden comprar sus frutas y verduras en el mercado de los agricultores y visiten el camión del banco de comida para recibir un plato calientito, rico y gratis de comida. Muchas gracias.
We hope to see you there. And remember,
Recuerden,
yes, we can do it.
sí se puede. Sí
Thank
podemos.
you. Thank you.
Oh, the screen was still on. You have to do it again.
Okay, we say hope to see you there. And remember,
Sí podemos.
sí podemos. Yes, we can.
It's
Have
from
a-
our t-shirts that we have here for this
Those,
year.
those are awesome. And so if people walk, they're going to get one of those t-shirts.
They will get a very nice t-shirt. It won't be exactly this one. This is to distinguish our staff, but they will get a t-shirt, and it is a very nice t-shirt as well.
So ladies, you talk about the increase in breastfeeding in our county. Do you think that locally having this fair and this kind of community engagement has really helped with those numbers?
I feel, yes, definitely. These type of events definitely create awareness, which is what we need. But I also feel that the work we do every day here at WIC and also the work we do in the community, we do work with the local hospitals, local clinics. So we do put in a lot of work. And sometimes it's very difficult because, you know, it's sad that not all babies are exclusively breastfed for that long, and we want to extend that. And we just want to make sure moms get the resources. And what I find interesting is that this program, this WIC program, works mostly with the agricultural working moms. And that's a big challenge when it comes to pumping at work, if you can imagine that. It's not like they have an office where they can sit and pump. Yet, you know, a lot of them are still trying. So I think that speaks volumes of the WIC program.
Working mothers need help all the time and in many different levels. You mentioned what WIC, a little bit about WIC. Can you briefly describe for those who don't know what WIC offers?
Yes, so WIC stands for Women, Infants, and Children. So what we do is we see moms prenatally, infants, and children up to the age of 5 years old. And we provide, it's a supplemental program that helps with a certain amount of foods. But in order for the families to get these foods, we collaborate with education. So what we do is, you know, we create that relationship with the families. They come, they do appointments, they receive a lot of education, not only during pregnancy, but also for infants and just children in general. And they, each month, they get like a card where they are being able to purchase, you know, necessary groceries, whole grains, fruits and vegetables, dairy. But I think the important part of it is just the education part, that they're getting that education part each time they come to their appointments.
Ladies, thank you for all you do at WIC, and thanks for, it's going to be another great year, I just know it.
Thank you.
Thank you.
And thanks everyone for joining us.
Well, before we go, and Maya knew this probably was going to happen when she saw me walk in the door, I just want to let you all know that this is, Maya is retiring from the county of Monterey, and sadly, this is, she's leaving us, well, not too far. She's going to stay in Salinas, but she's leaving our little team here. And I just didn't want to let you all go without acknowledging her tremendous talent during these news briefings. She's done an amazing job, and she's going to kill me after this, I'm sure. But we are going to miss her tremendously. And to everybody who's watching this now and everybody who will watch this in the future, There's no one going to do as good of a job at this news desk as Maya Carroll has done for the last many years and her 25 years here with the county. So on behalf of the County of Monterey and the Communications Bureau and the County Administrative Office, Maya, thank you so much for everything.
Thanks for making me cry.
And that's the end of our news briefing this week. We'll see you
Now,
back
wait a
here
minute.
next-
Then you have to give me a chance to thank everybody.
There you go.
Because the news briefing started during the pandemic as a way to get quick information to residents and the press when they really needed it most. And it has stayed going all that time only because county staff stepped up and realized that it was a way for them to share. It's happened because people came and stayed and watched and took that information. So for all the people who have participated with me all these years, I thank you. And our next briefing is next week. We'll see you then.